my name is Eliza. I'm going to be performing nasopharyngeal suction on a patient. Okay, so first I'm going to come in and introduce myself and say, hi, my name is Eliza. And then I'm going to ask for the patient's name, date of birth. And if I check that wristband, it should be the same. And then I'm going to provide some privacy, some hand hygiene. And then I'm going to tell them that the doctor ordered a nasopharyngeal suction. Is that okay with them? And they would say yes. If they would ask me what it is, I would explain to them what nasopharyngeal suction is. So then I would make sure that the patient is in a semi-Fowler's position and make sure that they're comfortable. And then after that, I would start my assessments. So first I would be assessing for their level of consciousness, make sure they're speaking full sentences. Then I would see if they have a productive cough. If they do not have a productive cough, that means they're not getting out the secretions that they need in their body. And then I would check their vital signs. So I would take this O2 saturation, pulse ox, sorry, and then I would put it on their index. And then if their O2 sat is low, then I would put a oxygen mask, which the patient already has on, which is a non-rebreather. So that means their oxygen saturation is below 94%. So then I would check their blood pressure, their heart rate, their respirations, and their pulse. Those should be pretty increased. So then I would see I would measure the color of their, or see the color of their sputum and measure how thick it is. And usually with patients like this, it's green, it's pretty thick, and they can't get it out. So then I would start suctioning, or you can start suctioning. Ooh, I keep missing it. Okay, so then I would turn it on. Okay. And make sure the pressure is between 100 and to 150, and that's normal for adults. So then I'm going to check and see if the suction is actually working. So it's working, it's pretty good. So then I'm going to open my tray, put on my goggles. So these are sterile gloves. So I'm going to place the glove on my dominant hand. Okay. So now I'll take this, remove the catheter, place it right here. And then I'm going to take my non-dominant hand and pour some saline solution into the tray. And then I'm going to take some lubrication and put it into a cup. So next I'm going to take the catheter. Next I'm going to take the catheter. Or before I do that, I'm going to actually place my other glove on my hand. Okay, so then I'm going to take my catheter and I place it to the suctioning device. So I'm going to insert it. Okay, so next I'm going to actually clean the catheter. Make sure that's clean before inserting to the patient's nose. Okay, so that is good. So next I'm going to measure, remove the oxygen device off the patient's face. And I'm going to measure from the mouth to the top of the earlobe. So it's about 19 centimeters. So then next I am going to lubricate the catheter. Make sure that's out the way. Then I'm just going to ask the patient to take slow deep breaths, and then I'm going to insert it. Make sure I'm going to the 19 centimeters. Out there. And I'm just going to slowly rotate, ask the patient to take slow deep breaths. And I'm going to do this for about 15 seconds. okay, then I'm going to take it out. Put the oxygen mask back on. Then I'm going to clean again with this normal saline solution. And then I would lubricate and then repeat this step, but I'll wait 30 seconds before doing it just to give the patient some time. And then afterwards, just remove this with my non-dominant hand, or my dominant hand. That away. And then with my non-dominant hand, I'm just going to clean the suctioning device just to make sure all the secretions are out. Okay, that's good. Turn the device off. Make sure everything is cleaned up, and then make sure our patient is in a comfortable position. Some things to remember, I would just make sure that I went from nose to mouth and not mouth to nose, just to make sure, because the mouth is dirtier than the nose, so I will go from clean to dirty. And some intervention, to know that my interventions worked, I would reassess the patient to make sure that their O2 saturation is up, their color is back to normal. I'll also check their vital signs and check their sputum. So,
how do you know your patient needs suction?
well, if their heart, blood pressure, respiratory rate, and pulse are increased, and if their O2 saturation is low. And if they're not having a productive cough, that means they're not getting the secretions out. And if their sputum seems to be thick and a different color like green.
Are there any contraindications to nasopharyngeal suctioning?
Yes, there are a few. So if the patient was to have bleeding from their nose, a broken nose, or if there are any blood thinners.
Can you suction from nose to mouth or mouth to nose?
Well, typically you would suction from nose to mouth and not mouth to nose because you want to go from clean to dirty.
Okay. Which oxygen delivery device would you use if a patient had an O2 stat of 74%?
Well, I would use a non-rebreather mask. As you can see, this patient is, because their O2 stat is below 74%.
How do you know that your intervention suctioning has made your patient better?
If the patient is now coughing, is pretty productive, if their O2 saturation increased, and if all their vital signs were stable.